It is September 16, 2025, and the heat is merciless. Mobile devices reach 36 degrees Celsius. It's blazing hot. Most villagers have already retreated into the shed, but not Senzeni Nemali. She arrives at the Bhunu homestead in the Bhunu village in Gokwe North. Senzeni is one of the 66 village health workers trained by the Zimbabwe Red Cross Society and the International Federation of Red Cross and Red Crescent. She's mobilizing communities under the Saving Lives and Livelihoods program funded by MasterCard and Africa CDC. The second phase of the program began in June and runs until September 2025. As Senzeni arrives at the Bhunu homestead, she's greeted by an old lady, probably in her 90s. She's mother to the villager, Mr. Charles Bhunu. Mr. Charles Bhunu walks slightly behind them as Gogo Bhunu and Senzeni exchange pleasantries as they head towards the shed where Senzeni is going to have the first meeting. A few ladies from the village join them under the shed, where Senzeni will be conducting more of lessons for the day with regards to healthcare.
Pambone project yedu inonzi Saving Lives and Livelihoods in community. Ikurudzira vanhu kuti vagove neutano hwakanaka. Saka tiri kuti kune vasikana vaya vamwe vasingaendi kuchikoro vane ma10 years. Munofanira kuti muinde navo kumapoints vanenge maudziwa madhesi vanobayiwa majekiseni ekudzivirira HPV, gomarara remuromo wepachibereko. Vari kuchikoro havo vanenge vachibayirwa ikoko. Kozoitazve tokurudzirai kuti vana vanenge vachibayiwa jekiseni inonzi TD kubva pa5 years vanobayiwa. Havazi ne10 years vobayiwa zvakare netetanus, diphtheria. Tichizokurudzirai kuti kune vana mai vanenge vabereki vanenge vachirwara vari mudzimba.
Zvavanokuuya nazvo vachitibatsira vanobaya vana majekiseni, madhepo, zvakawandisa zviri kuuya. Uchihwa musoro ukangoti ndihwa musoro vanokupa mapirisi, ukati ndihwa chakati vanokupa mapirisi. Saka tiri kufarira izvozvo chirongwa ichocho kuti aiwa ndosaka ndati chipatara chavuya mumba. Pakaoma taiti chero munhu akakuvara chero usiku izvozvi kubva munhu pano toti munhu ambokwa musamba unosvika zuva radai, kubva pano kuenda kuti kwapindi unosvika zuva radai. Saka kudoreva kuti unowana munhu anofa munzira asati asvika.
Ndikuona pane chirongwa chakaitwa nehurumende. Chirongwa ichi chakatinakira zvikurusa. Tachitambura makore ese kuya kwatakaita munhu tingofamba kwabhinda kumutora kupi, pamwe tifamba netsoka, ngoro hapana, madhonga hapana, mombe dzine nzara. Saka zvakatinakira izvi zvakarongwa nehurumende kuti tifambirewo pamasenters edu ari padhuze okunoku. Ava vashandi vedu vemunomu vari kutiudza chirongwa nguva nenguva tichinozara pamashopu pasenta pedu apa.
Gokwe North has 28 health facilities. However, to get them is the real struggle.
As a district, we have got 28 health facilities. Out of the 28 health facilities, 25 are being supported by such under the outreach activities, and out of the 28, 22 are primary health care facilities being supported by Red Cross for the RCCE project. 66 village health workers were trained for social mobilization by Red Cross Zimbabwe and IFRC. As a district, we have got a total population of more than 360,000 in our district. For the 66 trained village health workers, they are doing social mobilization, of which they are doing door-to-door mobilization, where they will be visiting our homesteads, doing health education on different services and activities being done at our facilities, at district outreach activities points, as well as facility-based outreach activities.
The terrain in Gokwe is not for the faint-hearted. Narrow paths snake through thorny bushes and jagged rocks, leading to scattered homestead perched in places so remote you can't help but wonder how anyone managed to settle there. Clinics are few and far between, with some as distant as 25 kilometers or even 30 kilometers away. In such an environment, seeking healthcare often means risking dehydration, exhaustion, or worse.
But distance kunogondisa zvangu vanonyatsa kumasi iri kumaround 25 kilometers kuenda kukiriniki.
Ndiri kubara kiri nechirongwa chakauya chekurapira vanhu padhuze nekuti atine dambudziko rokuenda kure. Saka pane zvinezvi vana vakungobayiwa padhuze kana kuri kudonhedzerwa vanogona kutongoenda vega nekuti padhuze vachinodonhedzerwa kana kubayiwa. Taisiya mabasa achienda kure. Saka pane zvinezvi mavhileji yote vekaise danouya achitizivisa kuti mangwana vana vari kubayiwa. Saka tobva taudzana tose toenda padhuze. Saka zvakatikoshera izvozvo. Tinotenda nechirongwa izvozvo dai maramba makadaro.
Village health workers are bridging the gap.
Izvi ndakazotrainwa kuti ndishande paproject Red Cross Society. Saka muproject iyi tiri kufamba door to door tichidzidzisa vabereki maringe nezvekubayisa vana pachirwere pakudzivirirwa kwegomarara rechibereko remuromo wechibereko vaibayisa vana vasikana vari pa10 years kana kuti vari mugrade 5 majekiseni eHPV kudzivirira chirwere chegomarara remuromo wechibereko. Uyezve vana vari pa5 years kuti vabayiwe majekiseni eTD vozobayiwa zvakare pa10 years.
Our first day ends and we now head to Jireya, where we'll spend the night. The road is bumpy and unforgiving. The following morning, we are woken up by the sound of turkeys moving around homesteads. Before heading into the field, the mobilization team briefs us on their work in nearby villages. We head to nearby villages to see some village health workers in action, where they engage with communities and inform them on the benefits of immunization. We then depart to the first site where an outreach team is working today at Hongoro Primary School. At Hongoro, the team is already on the ground, already conducting screening and immunization activities. Mothers from all walks of life have brought their children, and the elderly have also come to get screened for non-communicable diseases under the integrated program. Immunizations, routine immunizations, screening for NCDs, and even care and treatment for those with non-communicable diseases is offered. Accessing healthcare services in these parts is not an easy feat. Even basic services such as contraceptives sometimes can be a challenge to access. Many times, shop owners capitalize on the crisis to sell medicines such as contraceptives and other medicines at exorbitant rates. However, the outreach program has brought solutions. With the team on the ground, children, adults, and the elderly are all catered for under this integrated program.
We are here at Hongoro Outreach Point, which is where we are offering service at a primary school. The main indicators that we are looking for are the target group, which are the grade 5s. This is the reason why we chose Hongoro as an outreach point. For the grade 5s, we are targeting the girls whom we are vaccinating against human papilloma virus so that we prevent cervical cancer. So the cohort is mainly the grade 5s. So besides HPV, We are also targeting TD, which is tetanus and diphtheria, where we are targeting the 5 years and the 10 years. So this is the reason why we chose a point which is roughly 95 kilometers from the district hospital and around 22 kilometers from the closest health facility, which is Madzivazido, under headman Madzivazido. So besides vaccination, we have managed to integrate services. We are also offering NCD screening. That's why the outreach team is composed of a psych nurse, a doctor, and community health nurses.
Sakuru Dzingai Kumasa praised the initiative.
Chakanakira vari kufamba vechipatara apa chakanakira ndechekuti tiri kurapwa mahara hapasi kubhadharwa mari, uyezve rodhi dzekuno dzakafa zvokuti vari kushinga kuuya vachizotibatsira. Saka izvo zvinotendwa stereki pano kuti makore makore angu ne65 years, saka kufamba kuti ndiwane kana mari yekunosvika kumutora ndinoishayirwa.
Dr. Addington Chugwari said the initiative is shortening distance to care.
One of the outreach points that took on my patients. Most of the patients that took on are elderly patients. And one of this program will benefit the elderly mostly because of the distance, to shorten that distance. If you realize my hospitals are my clinics are very poor, so it's really benefiting the elderly in terms of the distance. So for this age group, most of the conditions that we see now are diabetes, osteoarthritis, also hypertension. So this program comes most of these people are investing in medications. So to go now to medication closer to our elderly people.
From Hongoro Primary School, our journey ends and we head back. We wait for tomorrow, where we will travel an even longer distance. Gokwe North is one of the biggest and vast districts in Zimbabwe, and the work being done by village health workers turned mobilizers is incredible. Villagers in all these parts are praising this initiative for bridging the gaps to accessing healthcare in Gokwe. We take an early rest as we prepare to proceed the following morning to Ganganga Primary School, which is deep inside Gokwe. At Ganganga, it's already break time the following morning, and children, parents, and the elderly are already queued to access services thanks to the mobilization by the team. Village health workers are the foot soldiers of Zimbabwe's healthcare. They interact with communities. They access communities that are rarely accessed by other programs. These are the people on the ground. These are the people driving Zimbabwe's healthcare.